Okay, let's start part 6 here of skeletal with a clicker question. So let's think about this. After James' arm healed, the cast came off and he had a bump on the side of the fracture. Which cells would you imagine are working overtime to fix this problem of this bump that ended up where the fracture had been? And the answer is, oh, I didn't put it down there. So if it's excessive bone and you're breaking down some of that bone, then the cells that are breaking down excess bone to remodel would be the osteoclasts. So I can get my pen back, and the correct answer would have been osteoclasts. Didn't that do it? Yeah, there we go. All right, moving on then. This is what a fetus of 16 weeks would look like. It's pretty amazing, right? How you see all the bones, and you don't really see much of a difference between the skull and the other bones at this point. They look the same. All right, so let's take a look at those epiphyseal plates. Remember, that was the region that's still cartilage. It's cartilage that hasn't yet become bone, and in an x-ray it's going to look really different. So here you can see these lines. This is where that cartilage would still be, and it forms those lines along in the epiphyses of long bones. If you were to look at an adult hand here on the right, you're not seeing any of those lines. So this is a fully grown individual. These fingers are no longer growing. I was always surprised when some orthodontists will do that. I remember taking my kids to the orthodontist, and when they were younger, and they had an x-ray of their hand. And why were they doing that when we're talking about teeth? It's to see whether they've stopped growing or not, and to get a better idea of how the mouth is going to shape. So when do they seal? Well, at about age 18 in females, there's a lot of flexibility in that. A little later in males, they stop growing around 21. And after that, you're just not going to grow any taller. I'm so sorry to tell you that. But there's always going to be remodeling. Lots of remodeling is going to occur. It's going to matter whether you exercise a lot with weights. You're going to add bone to your skeleton, and if you stop doing that, you're going to remove bone from your skeleton. So it's something that's always actively remodeling. There's some data that shows that the distal region of the femur is fully replaced every 6 months. Is that amazing? That there is so much deposition and then removal and deposition and removal that it actually gets fully replaced. It's a good thing to know. The diaphysis of the femur changes much more slowly. So that referred to the epiphyses. The diaphyses, the more central region, is going to be a lot more slow. There it's going to be maybe the thickness of the bone, but there's actually less tension on the diaphysis. So we've talked about remodeling in bone growth, and it's going to be at completely different rates in the body depending on what you're using your body for. And it's going to be this constant sort of balance between the osteoclasts that are breaking down bone and the osteoblasts that are adding bone. So sometimes those osteoclasts are just recycling calcium. Other times, like in the example of the fractured arm, they're removing excessive bone that might have been there due to an injury. There's lots of different reasons for that breakdown of that bone. So what are the factors that are going to affect this? Are going to affect bone growth specifically. And the diet is big in this. Do you have enough calcium? Do you have enough phosphorus in your diet that's allowing you to continue with this deposition in bone? If not, your bone, your organism is going to remove calcium from the bone to put it elsewhere. Vitamins, of the vitamins, A, C, and D are the most important in this bone growth mechanism. Exercise, of course, especially weight. So the more force that a muscle puts on bone, the more the bone is going to sort of deposit more calcium there in order to be stronger, to be able to resist the weight of that muscle that's pulling on it. There is a video on the development of bones, so I've just left this slide in so that you could look at it in the other section of Canvas. And here's another clicker. The secondary ossification center is found where? In what region of the long bones? Secondary ossification. And the answer to that would be, let's see if I put it in, I didn't, is the epiphysis. So we are epiphysis of long bones. This is good because you're getting used to using this vocabulary. Okay, so this section here, we're going to look at fractures and the repair of those fractures. And we got some really nice drawings here. So ouch is right. This is considered an open displaced fracture because it is poking out of the epidermis here, out of the skin, so that it is displaced and displaced from the bone and open because it's coming to the outside. A green stick that's such a good description of it. If you were to take a branch from a tree and sort of bend it to the point that a piece of it flicks up. So you just have a region here that's sort of lifting off the bone, but it's not breaking entirely like it did here. So that's green stick. Comminuted fracture is when you shatter it. Not great. And then a linear fracture is just sort of a crack in the bone. On top of these descriptions, there are a description that has to do with the orientation of that injury. So is it a transverse orientation, this is non-displaced here, or is it oblique, or is it spiral, right? So this is spiraling around. So all this terminology, maybe we're going to use two of these. It could be linear and oblique at the same time. So this is all vocabulary that's used for these fractures. And they're just listed there for you, other than with a diagram, for you to just have them all in Word. So here's another clicker question. What type of fracture would this be? And sometimes it's hard to see, but what you do have to notice on this one is that this region of the bone here, I'm going to just draw into it here, is still intact. Okay, and this part here is lifting off. So in that event of one section lifting off. I remember. We should skip this clicker question, I realize now. This is, because I can show it to you so closely here on the computer, it's very evident that this is a green stick, but that's not one of the options that I gave you. So in this case, is it linear? Is it comminuted? It's not displaced. So the best one here is that there is a transverse, because there's a transverse break in it here. But it's also a green stick. I'd be very specific on an exam for you. Okay, so let's look at fracture repair, and this is going to be in steps. So if you could take it into steps, how would it look? So the first thing, that you've just broken a bone. Something happens, and we usually summarize it in these steps. You have bleeding, and then you have some sort of a callus forming that's not really the definite one that's going to stay. Then you have a bony callus that's the actual bone. This is the previous one is just cartilage, and then you're going to have remodeling. But I'm going to show you that in a whole lot more detail. So just think of bleeding, temporary fix, permanent fix, and remodel. Okay, that's sort of the big picture. So let's go to those one by one. This is a bone fractured that has a hematoma. So you've broken these little vessels, right? These arteries, and this is bleeding in this area. So you have a hematoma. And this is converted, I'm reading now down here, to granulation tissue, and because you have the invasion of all these cells trying to come to the injury, right, to fix what's going on here. So the first thing is bleeding, hematoma. Next, you're going to form some sort of callus. So your body's stopped the bleeding. These platelets have clumped together. You've stopped the bleeding, and then it has to be held together in place. So there's some collagen then that's secreted to that area, and some cartilage also here. And along with that collagen, those fibers, and the cartilage, it's going to sort of form, we call it a soft callus, which is this temporary repair. Okay? And it's made out of both fibers and cartilage. So it's still very sort of malleable. That's going to have to change and become bone again, right? So in blue here, every time they draw it in blue, it's because it looks like cartilage. The hard callus formation is now, I've had cells migrating to that area. I've had osteoblasts, which are young cells coming to that area. And they're going to start secreting matrix and hardening that region there. Those osteoblasts are going to convert to osteocytes, right? And so now we've made new matrix, we've brought in new cells, and we are converting this then to a more permanent callus, which really is the formation here of new spongy bone. And then here, this is hard callus of bone. But notice how you have a bump here now. This is sort of the leftover of the repair mechanism. And then the remodeling that's going to happen is we want to get rid of some of this extra here, right? So there, osteoclasts are going to move in and try and break that down. And if you've broken a bone, you know that it doesn't always work perfectly. I mean, it works perfectly to fix it, but the remodeling is such that you might still end up with a bump, and some of those bumps will stay. But the osteoclasts, believe me, have done some job there at removing that excess deposition of bone. Okay, so now we have a functional bone again that works. So that's the end of that one section. When the fetus, another clicker question for you, when the fetus is only 4 weeks old, it's safe to say that the type of skeleton it has is made predominantly of what? Is it compact bone, cartilage, spongy bone, epiphyseal bones? And given that it's only 4 weeks old, right, it's going to start out by having cartilage. These two concepts are what finishes up our chapter with a little bit of pathology, and that has to do with aging in the skeleton. So what is the difference between osteopenia and osteoporosis? Because this is a very important condition in the elderly, especially females, osteoporosis. So look at this bone. You know, this is what we think of as spongy bone, and that sort of looks normal. It does have little holes in it, but when it gets to something like this, you know, this is considerable loss of bone. And you can see how fractures become so much more prevalent, so much easier to fracture this bone if it's lost some of its trabeculae. Before we move on there, so osteopenia is not considered an actual disease. Osteoporosis is. Osteopenia is bone density loss, but it's sort of an alert saying, oh, look, you have some bone density loss. Let's prevent it from getting to the point of being osteoporosis. So it's sort of the stepping stone too, but you could halt it there with treatment. Okay, so osteopenia is before osteoporosis, and if caught at that time, it can be sort of held in place and not have it progress to osteoporosis. Another pathology is rickets with the lack of calcium and vitamin D. This kid has this bow-legged, do you notice? This is sort of bow-legged, which means that the collagen is there in the bone, but the lack of calcium is not giving it its rigidity. This is not something that you see around here. It's in just parts of the world where it's a combination of the lack of calcium, lack of vitamin D, and together those two can cause rickets, malnutrition also. This is where we're going to stop. Know that in this week you will finish tissues in lab, but you are also starting to look at the vertebral column and the cervical, thoracic, and lumbar vertebrae. So this is a really nice picture of that. You'll be able to, you're going to be looking at the difference. You know, what does cervical vertebrae look like? What do they have different from those that are in the thoracic region that have a rib attached onto them? And then the lumbar. So we talk a lot about how many of these. So there is breakfast at 7, and then noon is 12 here, so you have 12. Lunch at noon, thoracic vertebrae are 12 of them, and then dinner at 5, lumbar at 5. And that's just for you to remember. 7, 12, and 5. Okay, and you'll look at that in lab. So this ends the lectures, the mini lectures on the skeletal system. Thanks for listening. Bye.